students. So today I'm going to show you the total subject of post basic BSc nursing first year. In post basic BSc nursing first year there will be 9 subject and then 3 practical subject. So the 9 subjects are nursing foundation. You can see here nursing foundation, nutrition and dietetics, biochemistry and biophysics, psychology, microbiology, maternal nursing, child health nursing, medical and surgical nursing, and English. And practical subject will be medical and surgical nursing, maternal nursing, and then child health nursing. So I would like to say that this subject will be out of 100 marks, and these 2 subjects, nursing foundation and nutrition and dietetics, will be 50 marks and 50 marks. And then 3 practical will be there, the medical and surgical nursing, maternal nursing and child health nursing, for 100, 100 and 100 marks. So now I am going to show the unit of each subject. So first come to the nursing foundation. In nursing foundation there will be 6 unit. So I am going to show you the unit so you can understand the what topic will be there. So in unit number 1 this topic will be there. For example, development of nursing as a profession, its philosophy, objectives and responsibilities of a graduate nurse, trends. These things will be there. So I'm not going to explanation all these things because it will take more time. So I'm just showing you can for your better understanding, so you can see. And then unit number 2. In unit number 2, ethical, legal and other will be there. And then unit number 3, theory of nursing practice, meta paradigm of nursing. And then unit number 4, nursing process will be there. And then unit number 5, quality assurance. And then unit number 6, primary healthcare concept. Under the primary healthcare concept there will be community oriented nursing, holistic nursing, primary nursing, and then family oriented nursing concept. There will be problem oriented nursing, progressive patient care, team nursing. These things. Come to the nutrition and dietetics. In nutrition and dietetics there will be 4 units. In first unit, introduction to nutrition and dietetics, balanced diet, factors to considered in planning. These things will be there. Here the balanced diet is more important. And then come to the second unit. In second unit, introduction to diet therapy. It's important, and you can see the whole topic. And then unit number 3. In unit number 3 there will be infant and child nutrition, feeding of formal infants, factors to be considered in planning, nutritional requirements, and then weaning, these things. And then unit number 4. In unit number 4, community nutrition, need for community nutrition and program, nutritional needs for special groups, infants, child, adolescent, pregnant women, lactating mother and old people. And then next come to the biochemistry and biophysics. This subject is for little bit tough for the arts background student, because the biochemistry and biophysics there will be everything from science background, but it's easy when we'll study nicely. So in biochemistry there will be 6 unit. In first unit, the introduction of importance of biochemistry in nursing, study of cell and its various components, We all know cell, about cell, because class 9 or 10 there was a chapter in the name of cell. So this is easy for arts student also. And then unit number 2, water and electrolytes. These things are very important for the exam. And then water and fluid balance also important, electrolyte of human body functions, and then sources. And unit number 3, enzymes, mechanism of action, factors affecting enzyme activity, diagnostic applications. This one. Here unit number 3, the digestion and then absorption of carbohydrates, proteins and fats is important. And unit number 4, carbohydrate, metabolism of carbohydrates for energy purpose, and then glucose tolerance test, hyperglycemia, hypoglycemia as you know, and then glycemia. And then unit number 5, protein. Under the protein, amino acids, hormones will be there, essential amino acids, and then biosynthesis of protein in the cells, role of nucleic acid in protein synthesis. This topic will be come under the unit number 5. And then unit number 6. In unit number 6, you can see the fat will become the biosynthesis of fats and storage of fats in the body. And then next come to the section B will be what, biophysics. In biophysics, the 11 unit will be there. You can see unit number 1, 2, 3, 4. In unit number 1, there will be concepts of unit and measurements, fundamental and derived units. These topics are important for the 1 or 2 marks. And then unit number 2, vector and scalar motion, speed, velocity and acceleration. For 2 marks or 3 marks, it's important for short mark. And then unit number 3, gravity, specific gravity, center of gravity, and then effect of gravitational forces, human. And then unit number 4, force, work, energy, their units of measurement. We need to know their units, because the units it came for 1 mark. Sometimes it came for fill in the blanks, and then for true, false. So we need to know about their unit, it's important. And then principles of machines, friction and body mechanisms also. And then simple mechanism, lever and body mechanisms. All these things also very important for the biophysics. Next, the unit 5. In unit 5, the heat, nature, measurement, transfer of heat and effects of heat on matter, and then relative humidity, temperature scales, these things. And then use of heat for sterilization, this is important. And then unit number 6, light, law of reflection. This topic already we got in the class 9, I think, the 3 law, these things. So next come to the unit number 7. In 7 there will be pressures, atmospheric pressure, hydrostatic pressure, osmotic pressure, measurements of pressure in the body. Next come to the unit number 8. In unit number 8, the topic will be sound, frequency, velocity and intensity. And then application of these principles in nursing, this one is very important. Why the sound, we need to know the sound, about sound, why this is important for nursing student. Like this type of question sometime came, or sometime it's depend on the ma'am. Next come to the unit number 9, electricity and electromagnetism. Nature of electricity, voltage, current, resistance, and their units. As I told you, the units, it's very important for everyone. We need to know, it's important, we should know the units of the like a voltage, current, and then resistance. What is the unit of voltage, what is the unit of current, these things. And then next come to the unit number 9. In unit number 9, atomic energy, structure of atom, isotopes and isobars, radioactivity, use of radioactive isotopes. And then next come to the unit number after 10, the unit number 11. In unit number 11, principles of electronics, common electronic equipments used in the patient care. This is the last unit of biophysics. So next come to the psychology. In psychology there will be 12 unit. In first unit you can see the introduction, definition of psychology, scope of psychology, and method of psychology, and relationship with other subjects. I think psychology we already got in the GNM, so it's a little bit helpful for us because it's similar only. And then unit number 2, sensation, attention and perception, sensory process, normal and abnormal, attention and distraction. These things will be come under the unit number 2. And unit number 3, motivation. This unit number 3 is very important because their board question come from this unit, like motivation, definition and nature of motivation, biological and social motives, these things, self-actualization for short note. And then unit number 4, emotions. Here the important things is we have to by heart the definition of emotion, definition of personality, definition of learning, definition of psychology. We have to by heart the definition because we can't make it our own self. We have to write the exact definition of the everyone, like motivation, emotions, personality, learning. Next come to the unit number 5. In unit number 5 the include topic is personality, definition, constituents of personality in sickness and nursing. And then unit number 6. In unit number 6, psychological aspects of nursing will be there, behavior and sickness, psychological needs of child and adolescents, adult age, attendance, chronically ill individual. And then next come to the unit number 8, individual differences. And then next, significance of individual differences, heredity and environment. These 4 topic will come under the unit number 7. And then next come to the unit number 8. In unit number 8, the intelligence and abilities. And then unit number 9, learning will be there. We need to know the definition, conditions of learning, law of learning. And then next come to the unit number 10. In unit number 10, the memory and forgetting, memory during health and sickness, forgetting during health and sickness. And unit number 11, attitudes will be there. So we need to know the attitudes, definition about attitudes, development and modification, role of attitudes in health and sickness. And then unit number 12, in unit number 12, the concept of mental hygiene and mental health. Sometime for 5 marks the question will come from this topic, the mental hygiene and mental health, and then characteristics of a mentally healthy person, like this. So in psychology, the theory will come from the motivation. This unit number 3, motivation, theory of motivation, these things. And then from learning also, there are many law of learning. We need to know about this. And then next come to the microbiology. Hope you guys are not boring, because it's necessary to know the how many subject and how many unit are there under the subject. So just I'm thoroughly just showing you the topic name. And then next come to the microbiology. In microbiology first unit, you can see in microbiology first unit there will be structure and classification of microbes and morphological types and size and form of bacteria, motility, bacteria shape and size of bacteria sometimes come in exam. And then next come to the unit number 2. In unit number 2, identification of microorganism, discussion of laboratory methods and diagnosis of bacterial disease. Unit number 3, growth and nutrition of microbes, temperature, moisture and blood. And then next come to the unit number 4, destruction of microorganisms. And unit number 5, disease producing microorganism, gram positive bacilli. Gram positive, this one is important topic for the exam. And then unit number 6, in unit number 6, pathogenic fungi and dermatophytes. This dermatophytes sometimes come for short note or for 2 marks or 3 marks, and sometimes for 1 marks also. And then unit number 8, immunity. This topic, unit number 7 is important for the final exam. Immunity, the definition of immunity, type of immunity. And then next unit number 8. In unit number 8, parasites and vectors, characteristics and classification of parasites, protozoal infection and including amoebiasis. So I would like to say that the parasites and vectors, these are the main thing we need to know for score the good marks in exam. Parasites, mainly we need to know the how to write the morphology, because morphology is very very important to know about the disease, like malaria, and then sometimes it's come the protozoal infection, amoebiasis. If you want note from unit number 8, then I can give you. You let me know by the comment, and I can make a video on the topic of this unit, because this is important for the exam. Sometimes for 15 marks, 10 marks come from this unit. And then next unit number 9, viruses, classification and general character of viruses, disease caused by virus in the man and animal and their control. And then unit number 10, microorganisms transmitted through food poisoning and food-borne infections. This one's all these things are in unit microbiology. And next come to the maternal nursing. In maternal nursing there will be 7 unit. In unit number 1, you can see the introduction and historical review, Planned Parenthood. In maternal health nursing there are many important topics. You have to learn many things related to your GNM, and then like maternal morbidity and mortality rates. And then unit number 2, review of the anatomy and physiology of female reproductive system, female pelvics, and then fetal development, review of fetal development. And then unit number 3, psychology and management of pregnancy, labor and puerperium. What I say, if you will say the syllabus of maternal health nursing, it's look like important. Every topic is very very important, so we need to know deeply the every topic. Sign and symptoms of diagnosis and pregnancy, antenatal care, pregnant women with HIV and AIDS, management of common gynecological problem, and unit number 4, the newborn baby. It's little bit similar with the child health nursing. Newborn baby, care of the baby at birth including resuscitation, essential newborn care, feeding, jaundice infection, and then small and large for dead babies, intensive care of the newborn baby. Sometimes this topic come for exam. And then unit number 5, in unit number 5 you can see the management of abnormal pregnancy, labor, puerperium, abortion, ectopic pregnancy, and vesicular mole. I hope all of you know what is labor, the stages of labor, management of labor, puerperium, what is puerperium, and then abortion, definition of abortion, causes of abortion, and then types, mainly the types of abortion, ectopic pregnancy, what is ectopic pregnancy, the management, treatment, and vesicular mole, labor, puerperium, and abortion. These 3 are very very important for the final exam. And pregnancy induced hypertension, also PIAs, and then gestational diabetes mellitus, gestational diabetes, this one also very very important, anemia. Next, urinary infections, antepartum hemorrhage. Antepartum hemorrhage also very very important, APAs, antepartum hemorrhage. Sometimes a direct question for 15 marks, abnormal labor, and then postpartum hemorrhage. The postpartum hemorrhage also very very important. We have to know this topic about what is this means, what happened in this disease. And then I know all of you know already, because in GNM we got all the topics, all the problems like antepartum hemorrhage, postpartum hemorrhage, and then prolapse of uterus, inversion and prolapse of uterus, and then obstetrical emergencies, all these things. So in post basic BC nursing first year also there will be this included this topic. So unit number 6, in unit number 6, drugs in obstetrics, and then unit number 7, in 7, national welfare program for women, national family welfare program in infertile family. Here we should know the infertility, what is meaning by infertility, definition, these things. In vitro fertilization, surrogacy, what is surrogacy, what is in vitro fertilization, we should know. Next, come to the child health nursing. In child health nursing, the first unit is introduction, modern concept of child care, internationally accepted rights of the child, national policy and legislation in relation to child health and welfare, and then national programs will be there. We have to know the national program related to the child, which is help to growth and development child and the mothers, also antenatal mothers, and then included postnatal mother also. Child morbidity, mortality rates we should know, and then you can see. And then unit number 2, in unit number 2 the topic will be the healthy child, the growth and development from birth to adolescence, and the nutritional needs. This one is very important, nutritional needs of children and infants, breastfeeding, supplementary and artificial feeding, and weaning. Mainly sometimes the question come from the breastfeeding, mainly the what is exclusive breastfeeding. We should know what is the exclusive breastfeeding, the type of breast milk, like this. And then immunization, we have to know. If you don't know the immunization schedule, then it will be difficult to know. And then next come to the nursing. Next come to the unit number 3. In unit number 3, the first topic will be nursing care of neonate, and then nursing care of abnormal newborn, and then neonatal resuscitation. This one is very important. Neonatal resuscitation, nursing management, low birth weight, LBW. We should know how to take care of the LBW, that means low birth weight baby. Then nursing management of common neonatal disorders and organization of neonatal unit, prevention of infections in the nursery. And then unit number 4, nursing management in common childhood disease, nutritional deficiency disorders. This one is very important. We should know about the nutritional deficiency, like the PEM, which means is protein energy malnutrition. Under the protein energy malnutrition, we all know that the kwashiorkor, marasmus, these things. And then respiratory disorders. And then next come to the unit number 5. In unit number 5, management of behavior disorders in children, management of challenged children. This is the last topic, means this is the last unit of child health nursing. Next, medical surgical nursing. I would like to, before starting the medical surgical nursing, in child health nursing, the many topic is come by the disease portion, like hydrocephalus. What is meant by hydrocephalus? And then sometimes come the low birth weight, and then cardiovascular disease, respiratory disorders. They are did not mention, like, but we have to know the genitourinary disorder like nephrotic syndrome and Wilms tumor infection and congenital disorders, and then neurological infections disorders, epilepsy, meningitis, hydrocephalus, spina bifida, hematological disorders, anemias, thalassemia, leukemia, hemophilia, these things. And then endocrine disorders, juvenile diabetes mellitus, orthopedic disorders, cuff feet, and then hip dislocation and fracture, disorders of skin, eye and ears. These topics are very, very important. Then now come to the medical surgical nursing. In medical surgical nursing, the highest unit, 15 unit will be and come under the medical surgical nursing. The first one is introduction to medical surgical nursing. Here, this is the important topic in unit number 1, intensive care unit. The question, like, role of the nurse of intensive care unit. What is the role as a nurse in ICU? And then next come to the unit number 2. In unit number 2, nursing management of patient with the specific problems like fluid and electrolyte imbalance, dyspnea, cough, respiratory obstruction, fever, shock, unconscious, pain, acute illness, chronic illness, terminal illness, age-related illness, patient undergoing surgery, and incontinence. Here the main topic is fluid and electrolyte imbalance. This is important. And then unconscious, this one is also important, and patient undergoing surgery. Sometimes question come like the nursing management of patient undergoing surgery. What will the nursing role as a nurse? What are the role of a patient who is undergoing surgery? So we should know. And then unit number 3. In unit number 3, the nursing management of patient with the neurological and neurosurgical conditions. cerebrovascular accident, this one is important, CBA, had an intractable pain, epilepsy, and then next come to the unit number 4. In unit number 4, the main is cardiovascular problem. In cardiovascular problem, there are many problem will come, mainly ischemic heart disease, angina pectoris, congestive heart failure, and then rheumatic and other vascular heart disease, and that means rheumatic heart disease sometime come, and then endocarditis, heart block. These are the main important topic from unit number 4. And then next come to the unit number 5. In unit number 5, nursing management of patient with the respiratory problem, who have respiratory problem like bronchitis, asthma, and then emphysema, and then pneumonia, and then pulmonary tuberculosis, lung abscess, pleural effusion, and then tumors and cysts. These are the important. In medical surgical nursing, we should know the many things. We have to know deeply every disease condition. And then next come to the unit number 6. In unit number 6, the nursing management of patient with the genitourinary problem. Under the genitourinary problem, the disease will come nephritis, renal calculus, and then acute renal failure, chronic renal failure, and stage renal disease, and then spinal procedures, dialysis, and renal transplant. These things, but these are the important disease we should know for the final exam. And then unit number 6, nursing management of patients with problems of the digestive systems. The disease will come under this unit is GI bleeding, gastrointestinal bleeding, peptic ulcer, and then infections and acute abdomen, colitis, diarrhea, and then malabsorption syndrome, cholecystitis, hepatitis, hepatic coma, and cirrhosis of liver. Cirrhosis of liver is very, very important. We should know for the 2 marks, or sometimes it's come for 5 marks also. Pancreatitis, hernias, everything we should know. At least we have to knowledge about the disease portion, because if in final exam if they give, then we have to write. And then unit number 8. In unit number 8, nursing management of patients with the endocrine problems. What are the endocrine problems? Like thyroid disorders, diabetes mellitus, and then adrenal tumor, pituitary disorders, diagnostic procedures. And then nursing management of patient above the problems also we should know. And then unit number 9. In unit number 9, the nursing management of patients with the musculoskeletal problems. What are the musculoskeletal problems we should know? Like arthritis, osteomyelitis, and then fractures, dislocation and trauma, prolapse disc, osteomalacia, and then osteoporosis, tumor, amputation. We should know amputation. We should know for 2 marks. And then next come to unit number 10. Unit number 10, nursing management of patients with the disorders of female reproductive tract, disorders of menstruation, infections of the genital tract. And then unit number 11, nursing management of patients, the oncological disorder. In oncological disorder, types of neoplasms and related to pathophysiology. Here we should know in medical surgical nursing, we should know the pathophysiology of the disease. We should know, because sometimes question may ask the pathophysiology of the diabetes mellitus, like that, pathophysiology of the rheumatic heart disease. So we should know the pathophysiology. If we know about the disease portion, then it will easy to know or make the pathophysiology. So we should know the pathophysiology. Don't avoid this topic, the pathophysiology. We should know the pathophysiology for every disorders, for every disease. Next, come to the unit number 12. In unit number 12, nursing management of patient with burns. Sometimes it's come for 5 marks. The management of burn patient, like this. The nursing management of patient with the reconstructive surgeries, like. And the nurse unit number 13. In unit number 13, nursing management of patients with common communicable disease like STD, sexual transmission disease. We should know about what are the sexual transmission disease. What are the gonorrhea, like gonorrhea. And then next come to the nursing management of patients with immunological disorders including SIB and then AIDS. SIB and AIDS is very, very important. Should know. Sometimes they ask the full form of SIB and then AIDS, like this. And then unit number 14. In 14, nursing management of patients with disease eye, ear, nose, ENT, that means throat and skin. Eye, ear, nose, we should know. And then here you can see unit number 15, nursing management of patients with the blood disorders. What are the blood disorders? Anemia, leukemia, bleeding disorders, hemophilia and purpura. Anemia, leukemia, these two topics is important. Blood, sometimes blood transfusion should know. And then unit number 16. Unit number 16 is nursing in emergencies, cardiac emergencies, trauma, poisoning, crisis management. 16. So total unit from medical surgical nursing is 16. Okay, it's not 15. It's unit, total unit is 16. So next come to the English. In English there are 4 units. How many units? There are 4 units in English. In unit number 1, we should know remedial, study of grammar, review of grammar, vocabulary, and effective of use of dictionary. And then unit number 2, the ability to understand selected passages and express meaning in one's one word. And then unit number 3, study of various forms of composition. Note taking, diary, nurses notes. These are important. Nurses notes, anecdotal records. And then unit number 4, verbal communication, the type of communication, definition of communication. And then oral report, summarization of discussion, debate. These are very, very important for the English. And then tense, narration, voice change. These are also very important. We should know. So guys, thank you so much for listening. Next we will discuss about disease portion. So you can comment if any doubt regarding with our unit or subject, so I can try to make a video on that topic. So thank you so much.